Now it's my pleasure to introduce to you the Dean of Dentistry and Head of School, Professor Lindsay Richards.
Thanks, Nicole. People normally clap when I finish, not when I start. Only because they're pleased to hear me stop. So. First of all, can I just acknowledge that this morning we meet on the land of the Kaurna people. Kaurna people were, are and always will be the custodians of this land, and we respect their elders past and present, and we particularly do that in Aboriginal Reconciliation Week. So, I wanted to talk just for a little while. The format of the day will be that I'll talk for a bit about dentistry in general and the university, and then Sue Gardner and Demi Lekis will talk about the admission to the program. A lot of people say that the hardest thing about all of this is getting into dental school. After that it's relatively easy. So it's not really easy, but it is difficult to get in, and you need to understand those processes. So Sue, as chair of our admissions committee, is going to talk about that. And then Sue, as a teacher in the oral health program, will talk about that program, and Demi will talk a bit about the dentistry program. First of all, our university is structured in a certain way, and we have faculties of all sorts of things, but we live in the Faculty of Health Science. And just to put that into context, this university, we're very proud to say, is, in terms of teaching, ranked number 1 in health science in the country among the group of 8 universities. So they're the large universities, Sydney, Melbourne, Western Australia, Queensland, Monash, that group of universities that we compare ourselves with. What happens every year, there's a survey of students and of graduates, and we benchmark ourselves then against how we're going generally. That's done for all graduates, I think 3 or 4 months after they leave. And on last year's data, our teaching's ranked first among that group. Of all the Australian universities in health science, we're ranked number 2 for overall satisfaction that students express at the end of the course. And just in things like, for all the universities, we're 3 on things like generic skills and whether you can find a job at the end of your training. So they're things that we're very proud of. So if you choose to come to the University of Adelaide, you're coming to a faculty that's well regarded nationally and internationally as well. Within that faculty we have 5 schools: medicine, nursing, dentistry, psychology and public health. And dentistry obviously works within a dental school. And we have an exciting future, I think. So the university's invested its largest ever investment in our faculty. So they're spending almost $300 million on building a new building, which you may have seen down the other end of North Terrace. It's now right up to its full height and will be open for teaching next year. So people who are coming here next year, maybe not so much for dentistry, but for the faculty in general, will start teaching down there. And then for dentistry, the top 3 floors of that building will be our new Adelaide Dental Hospital. Currently that's located on Frome Road. It's been there since 1923, but come the middle of next year, we'll move to brand new facilities. And if you chose Adelaide for dentistry for no other reason, our clinic will be on level 10, 11 and 12. Not only will it be the best dental and the newest dental teaching hospital in Australia, but it'll have far and away the best view. So I've been to most of the others, and I've also been up to the top of that building, and if nothing else, the view from there is spectacular. And we're in a lucky position here in Adelaide that we went through a very difficult process a few years ago where we had to tender for the role of teaching dentistry in South Australia. The government put that to tender. We won that tender, but now we have a 30-year contract for teaching dentistry, which puts us in a very favourable position. When I meet with the deans in other schools, they all have to negotiate with their public health system every 6 months or every year for what patients they'll have and how they're going to work. We've got a very secure future here in Adelaide now with the university's investment in the infrastructure we need in terms of the building, and also for our relationship with the South Australian Health, OSA Health, means that we have a very comfortable niche to operate in terms of patients for teaching and also facilities. It's easy to say you'll have a first-class experience if you come to Adelaide. There's a few reasons for that. Firstly, the infrastructure I talked about. And the picture you can see there is our simulation teaching clinic. So in terms of clinical experience, if you come to our school, we think it's important that you begin your clinical experience as early as you can. So in both our programs, you will see patients of sorts. Usually it's just other students, but you'll be in the clinic doing what dentists do right from the beginning of the first year of the program. So if you get to know what it's like to be a dentist very early on in the program. More traditional programs, you won't do a lot of clinical work until second or third year. So we start in the clinic very early. And then in terms of procedures and things dentists and oral health therapists do, you learn to do that first of all on patients that look a bit more like that than people walking down the street. So these are simulation mannequins, and students in our program spend a lot of time in our simulation clinic just across the grass here, where you learn to do all the things that you need to do before you start in the clinic. So it's a process of learning in theory, learning in simulation, and then moving to the clinic. And we've got a 92-space simulation clinic that looks a bit like that. When you're working there, it's just like being a dentist. The equipment's the same, the problems are the same, but you get to practice a lot in that environment. So we've got good facilities. There are 2,500 dental schools in the world, and there's an international ranking system for dental schools, and we're very proud and pleased of the fact that in that system of the 2,500, we're ranked 29 in the world. So we're a good dental school. You can ask me if you want to, what about the other Australian schools? Melbourne's ranked 28, we're 29, Sydney's 40-something, and the rest of them are not in the top 50. They only report the top 50 in the world. So in terms of dental schools, this is a world-class dental school. And what stands us apart from the other two schools that are ranked in the top 50, Melbourne and Sydney, is that we're the only one that's direct entry from school. If you choose to go to Sydney or Melbourne, then you have to do another degree first. They're graduate entry schools. So that makes us a top-ranked school in Australia that you can enter straight from high school. So we've been around for a long time. 2017 will be the start of our centenary celebrations. In 2017, the university met with a local profession and decided to teach dentistry in South Australia. First students came in 1917. The centenary is 2017. 1920, the first students started. 1923, the first graduates came. We've got accredited programs in all the things, undergraduate and postgraduate. So if you come to Adelaide, we have undergraduate training clearly, but then for specialist training and for research training, we have a full range of programs in all those areas as well. And also lots of opportunities. We want to provide the most diverse experience you can, or that we can. So we'll have our 45-chair teaching hospital at the end of the other end of North Terrace. We also have a total of 105 dentists like to talk in chairs. Our medical friends talk in beds of hospitals, but we've got 105 teaching chairs around the state. So 55 are in the hospital, the other 50 are out in the community. So there's lots of opportunities for community placement and the sort of things people will do. Simulation I talked about, but then we have community outreach programs. In addition to the community clinics, which are the large government clinics where routine dentistry is done, we have a community outreach program. So most of our final year students in BDS and BIH would have an opportunity to rotate through there, and that's down in Light Square, and it's a particular program that we've set up, the university's set up, where we engage with Adelaide's homeless community and provide services for people that wouldn't otherwise engage with health services. That's been spectacularly successful. It's good experience for students and for staff who work there, and a really positive thing the school's doing. So part of our program aims for a diversity of experience, rather than spend all of your time in a teaching hospital in a sort of very supported environment, but seeing a narrow range of things. We aim to provide the largest range you could possibly have. So working in that clinic and the other end of town is a good experience. If you want to go a long way, we also run part of the Royal Flying Doctor Service service to remote locations. I don't know if any of you guys done that yet? No? So in final year BOH and BDS students, many have an opportunity to work with the Flying Doctor. That program's based in Whyalla, where we own a clinic, but from that clinic, we service Marla, Minapa, Unadada, those places. And our students fly out on Friday and we'll go and look after all the people in that community over the weekend, then come back. Usually come back, not always come back, because we've got to Unadada and there's been so much rain you can't get back. And then I've got these messages, oh, we're now in somewhere, the plane's in somewhere, the road's blocked. So the worst effort was it took a whole week to get back from one place, but it's a good experience. The other point to make is that dentistry is not a complex profession, but we all occupy different parts of the profession and fill different roles in the team. So it's a complicated team that consists of dentists, and some dentists will be in specialist practice, oral health therapists who practice in the areas of hygiene and therapy, dental technicians, dental assistants, dental prosthetists, and the programs that we're talking about today are the two up in that part of the range. So we offer those programs here, and people practice in these domains. These programs are generally offered in the TAFE system, but when you leave dental school, you'll be working in a team with all those sorts of people. So I didn't particularly want to talk any longer than that. There'll be plenty of opportunities afterwards for questions and answers. That's a broad view of the school, of what we believe in and what we try and do. Sue's now going to talk about the admission process. So Dr. Gardner's the teaches in our oral health program, but also is the chair of our admissions committee. Thanks, Sue. Yeah, hold it.
Just stick it on here. Need about 3 hands, don't I? Thank you. Where's the clicker, Lindsay? Good morning, everybody. Just to continue on from Professor Richards' presentation, I'm here specifically to talk about the 2 undergraduate programs that we offer here, namely Dentistry and Oral Health. So first of all, how do you find out more about these programs? It's really, really important, if you're thinking about a career, that you understand the type of work or the type of study that you will be getting yourself into. So we really strongly encourage you to go and talk to oral health therapists, or go and talk to dentists, go and talk to dental specialists, dental hygienists, dental therapists, for example. And where will you find these people? Well, hopefully you'll find them working out there in a range of domains, for example, in private dental practices or in community dental clinics, school dental clinics, dental hospitals, and also those working out in the outer metropolitan regions and in rural areas. It's important to get an understanding of what the career is all about. What are some of the things that they do? What's their scope of practice? What are they restricted to, for example? And sometimes that depends on the where they work as to the range of duties and practices that they can actually perform. It's important to find out what they enjoy about their work. And also some of the challenges that they may face on a day-to-day basis. For example, if you're lucky enough to speak to people who work in some of the Indigenous communities in our rural and remote regions of South Australia, for example, they are faced with many, many challenges. So it's just fantastic, if you're considering working in that type of field, to have an idea of how to fix a broken down car should that occur, because these things do occur. So as all professions, there's always a downside, but it's just important to have a realistic understanding of what both a career in oral health and a career in dentistry is all about. So in order to prepare yourself for study, it's a requirement as part of enrolment here at the university that you all have to undertake a prescribed communicable infectious diseases clearance, also tuberculosis screening, criminal history checks, It's a requirement too that all students are registered under the professional body of Australian Health Practitioners Association, or AHPRA. It's also important to know too that English requirements are to be met for our international students. And once again, what's not up here too is a first aid certificate, which includes CPR, is also a requirement prior to the commencement of study. So further information about this you'll find in the undergraduate guide, or the 2007 guide, for example, like this, or just refer to the website for more specific details. But it's important that you have an understanding of that. What else? So what is the difference between a dentist and an oral health therapist? This question often comes up. So there is a difference. For example, the scope of practice is different. And what I mean by that is an oral health therapist is restricted in the type of performances or procedures that they're able to, that a dentist can do. So an oral health therapist, or a dentist, can actually do everything that an oral health therapist is trained to do, but it doesn't work the other way around. I'll go into that in a little bit more detail just a little bit further down the track. So the entry requirements are different as well. For example, the academic threshold for a Bachelor of Oral Health applicant is 70 or equivalent, and but for dentistry it's 90. So that's quite a marked difference there and then. So the length of the degrees are quite different. For example, dentistry is a 5-year program, whereas oral health is a 3-year program. So obviously dentistry goes into far more detail and covers many more topics in addition to what an oral health therapy program entails. And my colleague Dr. Lekas will also explain a little bit further down the track a little bit further about the role of a dentist. But it is, as I said, it is important to get that clear, the difference between an oral health therapist and a dentist. So in order to pursue a career in dentistry and or oral health, we are looking for very similar characteristics. We're looking for people that are able to demonstrate effective communication and interpersonal skills, because as already been mentioned, you'll be seeing patients right from first year. And although you know, during an interview you're assessed on your communication skills, these communication skills are built on throughout the entire duration of your program. So you're not expected to be an expert straight away, but we do expect you to have a fairly high degree of communication skills right from the word go. So we want you to have to be able to demonstrate, you know, a high degree of professionalism and ethical behaviour, because you're working with patients. You are expected to keep accurate dental records. You are working, as I said, as a young professional, and so therefore you need to be able to work with what we call a moral compass and work with integrity and display, as I said, all forms of ethical behaviour. We expect you to have good manual dexterity skills or fine motor skills. Whilst it's not an absolute requirement, it certainly is an advantage. So that's something that would certainly make certain aspects of your program a little easier. Teamwork is really, really, really important, because as we've already alluded to earlier, dentistry, or the field of dentistry, encompasses all different members of the team, and we expect everybody to be able to work together. So therefore good teamwork skills is pretty well essential as you move your way through the program. We also want you to have a commitment to the rigours of study. And it's not really like school, where much of the emphasis here in our dentistry and oral health programs is very self-directed. And so this self-direction is going to be terribly important once you graduate, because, as you know, dental advances there's changes in dental materials and new technologies are coming up all the time, and it's just imperative that you know where to go to keep abreast with all of these changes. So we need our students to be prepared for that lifelong learning and that continuous reflection on what you're doing. So what does first year involve for both programs? Well, both programs are full-time, so therefore we expect full-time attendance. Some people try to manage part-time work in addition to their studies, and with varying degrees of success, I might add. It's very, very important, though, to consider that this is a full-time program. And if you're able to manage some part-time work, well, that's fantastic. But just make sure that your priority to get through this program is that commitment to full-time study. You'll find the programs are the way they're structured. They're certainly very, very challenging at times, and so that's why we expect students to demonstrate a degree of resilience too, just how well they're able to sort of bounce back when they are faced with challenges along the way. And you will find that if you are able to overcome these challenges that may crop up during your learning, you'll find it certainly very, very rewarding. So much of the program content is delivered in small groups. We call them small group discovery experiences, where problem solving is sort of like the key aspect of those discussions. Class meetings occur, tutorials. There's, as you've seen already on the PowerPoint, there's a lot of simulated clinical sessions in our simulation laboratory. In addition to that, other practical sessions take place. You've also been alluded to the early clinical experiences. Early clinic experience, that's very, very important. You're also lucky at this university to have low student to staff ratios, so there's plenty of supervision that takes place and that is essential. Yes, and as I said before, it's a very patient-centred care that we provide here, and during that patient-centred care, we use optimal clinical communication skills along the way. And also students are taught to critique their own work continuously. It's important that in order to understand how you can better yourself, you need to be able to evaluate, well, how have I performed this particular task? Have I met the criterion for performing this particular task? And how can I perform this particular task better? So that's terribly important, and there's a lot of emphasis on how to critique your performance. So the education philosophy for both of the programs here is based on innovation and contemporary practice. We're very, very lucky to be delivering programs and course content that is certainly contextualised and very, very meaningful. It's also based on rigorous evidence-based practice. It's patient-centred care that we provide, and as I said before, clinical communication skills are taught throughout the duration of the program. Cultural competency and sensitivity to the needs of all patients is followed. Learning is team-based. Much of it is done working with others in groups, as I said before, and these groups are in various sizes. Sometimes you might work in pairs, sometimes you might have groups of 3 to 4, but also sometimes you might have larger groups, and certainly your tutorial groups are sometimes up to about 12 people. So the school, as I said, much of the learning mode is student-directed or is self-directed, and the tutors are there to provide plenty of guidance and support. And the school provides opportunities for students, as I said before, to become these lifelong learners that we expect upon graduation. So after graduation, there's certainly plenty of jobs out there, many opportunities for employment in private and public dental practices, in tertiary education. Some people choose to focus. Also in the Defence Force, there's opportunities there. There's opportunities for graduates to go into dental research or into health promotion. Some also choose to go into developing oral health policy, and some choose to take up health administration roles. Also, there's locum work that's available. I was just talking to a graduate, oral health therapy graduate from last year, who her work is flying in and out of remote communities, relieving permanent staff in Western Australia. So that's actually quite interesting, and she finds that really, really rewarding and really quite different. So there are a variety of opportunities that both dental graduates and oral health graduates can consider. Now I'd just like to focus specifically on the Bachelor of Oral Health degree. I'll just go back one. So the degree in oral health is a 3-year long program, and it consists of 4 integrated streams or courses in first year and in second year. And these 4 streams or courses then converge into 3 in the final year, in the third year. So the curriculum consists of real-life clinical scenarios where we link theory to clinical practice. Everything that we do in clinical practice must be underpinned by theory. So the clinical skills and behaviours are sort of taught concurrently. Research components exist in all year levels, and so by the time students get to third year, they undertake a independent, what we call an oral health elective, where they research a topic of interest that's going to have implications for them as oral health practitioners. And some of these topics of interest are really, really interesting that the students have come up with. And this year, for example, we've got students researching e-cigarettes and whether they are a healthy alternative to quitting smoking. We've got other students researching dental tourism, where the main focus of Australians going abroad is to seek dental treatment, and so that's how they define dental tourism. So in order to get to that stage, they have to have been introduced to basic research skills in first year, and they are continually drawn upon and expanded upon, so that by the time they get to third year, they're able to undertake this project quite independently. So oral health therapy students, during their program, they have the opportunity to learn and practice in a variety of settings, and these include in the Royal Flying Doctor Service, for example, providing care to, they visit nursing homes as part of their program. Some are lucky enough to actually go overseas, at this stage to Vietnam and Cambodia, to perform parts of their restricted clinical practice. Others work in, or everybody actually has to do rural placements down in Mount Gambier, Port Lincoln, and in the future Berry. And also much of their clinical work is done in outer metropolitan areas such as Elizabeth, Noarlunga, Marion, for example. So the oral health students also are very lucky because they're able to interact with dental students throughout their program and work on and, you know, having this collaborative approach to their learning as they sort of solve cases and managing clients' issues in using this team-based approach. So for entry into the domestic entry into the Bachelor of Oral Health, first of all, a SATAC application needs to be in by a specific date. Details of that you will find in the, on the website and in the guide that you're able to collect, the admissions guide. Then there's everybody who nominates Bachelor of Oral Health as one of their SATAC preferences will be invited for an interview. Then the academic result is considered, where, as I said before, the ATAR is 70. Then a check to see that the prerequisite subjects have been carried out, and depending on all of those processes, then that determines the application outcome. The interview is the first ranking level, and then the academic results is the second. So what can so that was the admissions guide where you find out more information. I didn't realise that slide was there. Oops. Okay. Just to expand a little bit further before Dr. Leckers talks about the Bachelor of Dental Surgery, I just want to be clear that you actually know what an oral health therapist does. An oral health therapist is able to provide restorative care to children, and by that I mean they can provide basic dentistry, like simple fillings on both deciduous and permanent teeth on young adults. They can work in specialist practices, in orthodontic practices, periodontal practices, paedodontic practices. They can do various procedures depending on the conditions of employment and their training. They can diagnose common dental diseases such as dental decay and periodontal gum disease and problems with the periodontium. They can take x-rays or dental radiographs, as we call them, make mouth guards, take impressions, etc. They can extract deciduous teeth or baby teeth. They can perform preventive procedures such as apply fissure sealants, temporary restorations, for example, fluoride treatments. They can give preventive advice to patients of all ages. And they can maintain various forms of gum disease, maintain and manage various forms of gum disease. They can provide oral health promotion and education to the wider community. They can work specifically in areas of gerodontology where they can provide advice to nursing home directors, carers. They can work in domiciliary care or in special needs clinics. They can also choose a career in education and teach to undergraduate or postgraduate students. They can work as tutors or academics or work in health education and research. So I think that's a long enough overview of what a Bachelor of Oral Health therapist can do. And now I'd like to invite Dr. Dimi Leckers up, who is the Program Coordinator for the Bachelor of Dental Surgery.
Thanks everyone and welcome, and thanks Sue. So I'll just sort of continue on where Sue left off, and a lot of it I won't repeat because we've already sort of broached most of it, but I'd just like to emphasise that the scope of practice is one of the key differences between an oral health therapist and a dentist. And I think both Sue and I, in our work in the admissions area and in our teaching in the programs, want to emphasise that one part of the admission process is to really have a clear understanding of the scope of both of these professionals. whilst they work in the same area of maintaining and supporting the community's oral health, they work together in a team. The dentist is the team leader, and the oral health therapist is part of that team. And it's important to understand that the scope of practice is different, a little bit different, the admissions process is different, and the features of both programs are very common, but the length of the programs are quite different. So dentistry is a 5-year full-time program, and we have a very innovative curriculum compared to all the other dental schools in Australia, in that we have one integrated large subject or course called Dental Science and Practice. And this is Dental Science and Practice 1, 2, 3, 4 and 5. And we integrate the theory, the dental sciences with the clinical practice, and we learn these things together to help us train our students to become like lifelong learners and fulfil the needs of the community, not just for once they graduate, but for their entire career. The dentist, as I mentioned, is the team leader and works in very close relationship with the oral health therapists, dental specialists, technicians and dental assistants. Our graduates develop the knowledge, skills and behaviours to manage the oral health care needs of people of all ages. And dentists aim to improve the quality of life for patients by preventing and treating oral, not just oral, so we're not just talking about the mouth, the dentist's role is also for the head and neck. So we manage the whole sort of not just the oral cavity, that's just part of it. Managing disorders that occur in the head and neck and oral facial region. These disorders can range from dental decay, gum disease, tooth wear, infections and oral pathologies, dental trauma and cancer. And dentists also play a major role in diagnosing dental disease from a general body perspective. So some of our patients will come to the dentist for the first time and we'll do an examination, and actually the dentist might be the first person who detects that this patient actually has diabetes. So there's a lot of research in the last 5-10 years showing a complex interaction between oral health and general health. And the dentist can play a key role in helping managing people's general health conditions as well. Dentists are involved in restoring the health of the oral cavity to improve function and aesthetics. Some of the treatments dentists provide include preventive care, fillings, root canal treatment, dentures, crowns, implants, and minor oral surgery procedures. So you can see there the scope is now broader, so it takes on what the oral health therapist does, and we also do more specialised procedures, managing more complex parts of the oral cavity. As part of the team approach in providing oral health care, dentists can refer parts of the treatment plan to the oral health therapists in the team, as well as referring some of the more complex oral conditions and the treatments of those to specialists. Dentists also have a major role to play in community-based oral health care, and as well as oral health advocacy at a government level. And certainly careers in dentistry, as Sue explained, are wide and variable. So it's not just working in a dental surgery, in private practice. Dentists can work in government clinics, higher education, defence forces, and all sorts of areas. So it's a fantastic career, both dentistry and oral health, and provides, you can work full-time, part-time, and that's why Sue and I encourage you all to actually go out and find out what oral health therapists and dentists do. Really, if you can get an opportunity even just to observe or to talk to someone, even if it's by Skype, you know, that gives you a good insight into the profession and what it entails. So there's one of our students working in Common Ground Clinic. And one difference too in the admission process for dentistry, it's quite a rigorous admissions procedure. It's high demand, so we have a lot of applicants every year for a small number of positions, and it's a 6-step process. Admission to dental program involves sitting UMAT, and I'll talk a little bit about the UMAT afterwards. So you register for UMAT, you register through SATAC, and then if you're successful, you'll be gaining an admission interview, and then we look at your academic results. So for those of you from year 12, there's a minimum of a 90 ATAR that needs to be obtained. And then it's a merit ranking process that then determines the final outcomes of the applicant pool. But it's important to show you this one. So we have all the details specifically related to admissions for both dentistry and oral health in this guide. And we highly recommend that you access this guide and you read it in detail. It actually tells you the information also about the admission interview for both programs. It tells you the criteria that we're looking for. And a little bit about UMAT. So UMAT has a website. A lot of the dental and other health science programs around Australia and New Zealand use UMAT as part of their admissions process. And in our case, what we would recommend is you access this website. It has practice tests. The University of Adelaide does not endorse any coaching or any of those commercial coaching as part of gaining entry, and that's just a personal choice that each individual need to make. Okay? But as a university, we endorse you access the information that is on the UMAT's website. Oops. And then just quickly, covering a little bit of one career pathway for dentists once they graduate, and that's dental specialisation. So sometimes some of our graduates, when they graduate, actually really keenly like a particular area that they've been working with, and our university here, the dental school, offers a full suite of what we call the dental specialisations, and these require at least a 3-year minimum additional postgraduate study. And you can see from the slides, we offer a whole range of the dental specialties. Some of you might be familiar with just a few of them, like orthodontics, but we offer periodontics, prosthodontics, endodontics. So these are the sub-branches of dentistry. Paediatric dentistry, forensic odontology, oral and maxillofacial pathology, and special needs dentistry. So we think that this one will become a big need in the future. We have an ageing population, so it's a specialty that's sort of growing. And some of you might be familiar with oral and maxillofacial surgery. So that's longer than 3 years. That also requires a medical degree as well. So that's a long training program, I think about up to 12 years or so. So our school does offer a full range of specialty programs as well to consider in your career path. So that's all from me now.
So I hope all those things were clear. There's plenty of opportunities for questions, but what I'd like to now do is introduce 4 of our students, Austin and Melissa from the BDS program, and Karen and Will from the BOH program. They're going to sit out the front here like they're ready to answer questions. There'll be some microphones around normally, what we do. You're going to have, so we can hear the questions. And we'll give these guys an opportunity to explain to you firsthand what the student experience is like. So, do we have any questions? Anyone got a burning question? Right in the front. Yeah? We got a microphone? Yeah. Okay. Just before we start with the questions, do you want to go along and introduce yourself so everyone knows who you are? So.
Right, so my name's Will. I'm a 3rd year oral health student, so I'm in my final year.
My name's Karen. I'm also in the 3rd year oral health.
Hi, my name's Austin. I'm a final year dental student.
Good morning, my name is Melissa. I'm a 4th year dental student.
Very good. Okay, so.
So are all sections in UMAT weighted equally? So or some of the sections have a greater weighting, for example, section 1 or
Nicole knows the answer.
There will be time at the end to ask those types of questions at the end, but just briefly, we weight all of the sections evenly. So some universities do weight them all differently, but ours is the final score, the raw score at the end. So, yeah, all weighted the same.
Thank you.
All right.
So we got any more questions? You better ask them. I'll start making them up if you... Just while you're thinking, does someone want to start off with, so what would be the best thing about your experience when you've been here, do you think?
Well, I'm in 4th year, and this is the first year that we actually start our clinical experience with the different fields of dentistry, so like removable prosthodontics, fixed prosthodontics, pediatric dentistry, and others. And so far, my favourite part of the course has been pediatric dentistry. I'm really enjoying it. We do apply some of the knowledge and skills that we've learnt in the first 3 years of dentistry, but there's just the behavioural management, dealing with children, it's quite different, and I'm finding it really rewarding to treat children, you know, just to get that smile on their face and that high five at the end of the appointment. Yeah, I'm really enjoying it.
That's what you hope for.
And moving on to 4th year and getting to 5th year, you then combine all the disciplines together and you try and overly manage the patient. And then the patient comes in your chair and you're the main clinician trying to address the problems and treatment plan. And that's a really good aspect because you can get them out of pain, you can restore their function, you can restore their aesthetics. And some patients come with a negative dental experience, and if you can alter their experience for the better, it's a really good opportunity with these interactions with patients.
So the training is really good. Having sim clinic, at first you go, okay, I can do everything, this is great. And then you move on to a real patient. It's a little bit different, but you can still bring back all the things that you've learnt during sim clinic and just have to move the tongue out of the way, because that is terrible.
Yeah, the one thing the sim clinics don't have is the saliva. That's an extra thing you don't realise. You're like, oh yeah, it's slippery. But it's a great diverse program that we've got. I think the 3-year undergrad program that we have in oral health, I mean, at times you think, oh God, this should be 4 years, there's so much going on. But it's great. You, from the get-go, there's a lot of theory. It's a very hands-on course. Our scope of practice as oral health therapists is quite broad, and we really enjoy what we do. We sort of range from, currently in our 3rd year, we have one day where we're doing therapy down at Marion or Elizabeth or Noarlunga in the community clinics, mainly dealing with children. And then for myself, I'm at the dental hospital on Frome Road, and that's where I do hygiene work. So we're working with adults and maintaining periodontal conditions and debridement and things like that. So it's really good to see sort of opposite ends of the spectrum. If you like working with kids, it's a great course to do. You get to work with kids all the time, and you work with BDS4 during their pedo rotations, and it's great. It's great fun, and great teaching staff as well. We're very lucky at this university. There's a lot of great tutors, good student ratios as well. But yeah, that's good.
Just on Melissa's point, the specialisation stuff in dentistry is probably a bit hard to follow, but I guess the way our program works is 1st, 2nd and 3rd year of the BDS is probably very general dental skills. So there's a lot of fillings to do, preventive stuff to do, periodontal stuff, gum disease stuff. And by the end of 3rd year, people are pretty good at doing the very basic dentistry stuff. Then 4th year, people spend time working through the specialties. So in 4th year, you do endodontics and a bit more perio, but children's dentistry, oral surgery, all those things. And then, as Austin was saying, final year, then you really return to a much more intensive general practice experience where you try and integrate all that. And especially if you go to Whyalla or Port Lincoln or any of our community or country clinics, you know, it's an interesting thing to think that, you know, I remember the first time we went to Port Augusta with students, you know, there's me and 2 students, and we're the best 3 dentists for about 100 miles. And so you have to be able to do stuff because there's no one else. So, and that's a really good experience. It really sets you up well then for graduation. And that's why we have that community practice stuff, that you need to, when people talk about, you know, when you graduate you have to hit the ground running. Well, it's one of the things we're quite proud of, that wherever our graduates go, we think they're going to hit the ground running with the experience we've given them. So, other questions? Yep. Do you want to? You know.
I've got another voice, so I can talk now.
Okay.
With regards to clinical placement, and you were stressing that it's a full-time degree, how much of that clinical placement occurs within the university holidays as opposed to university term time? So how much of the course actually extends throughout the whole year rather than just the university year?
Well, I can probably answer that because that's all changing. Our contract with the government requires us to operate our clinics 48 weeks a year. So depending what year you're in, you'll know well ahead when your commitments are. So first, second and to some extent third year, we comply with the normal university term times, and that's just because of the other groups we interact with. As you get further in the course, we extend the year, just for experience. So commonly our third year would be, I'm talking BDS, but third year BDS probably runs over 34 weeks or something, 32, something. Fourth and fifth year from now on in our 48-week contract is going to have, not every student works 48 weeks, you'll work probably 40 of those 48, and everybody has a staggered start. I was talking to the fifth year students yesterday, they've had the first experience of that rotation. So you know well in advance when you're going to be required, but it could be anything from mid-January through to mid-December. And we're very aware of the fact that for students who do want to or need to work, that's a significant impediment later in the course. I don't know what you guys work outside of uni time? Yeah? All of you? Some of you?
For first and second year, for me, for oral health, it was so full on that I didn't work. This year's a little bit more relaxed. It's still full on, obviously. I'm working a couple of days at the moment, but we'll be cutting back because obviously I need to study for exams at the end of the year. But yeah, definitely first and second year for myself, I didn't work at all.
Yeah, I'd agree as well from a oral health perspective. It's difficult to manage part-time work or casual work. If you can do it, that's really, really good, doing a good job. But yeah, Karen and I were able to manage some casual work throughout outside of university hours, whether it be hospitality, retail, something like that. But it's doable. It's difficult, but it's doable. Yeah.
Austin or Melissa, you?
Yeah, from my experiences and along with other students, we tend to find that with the 5-year dentistry program, the odd years are chill, and the even years are much more tougher. So in the even years, it's good because 2 years is it's a bit more intense because it's a large scope of learning, like a huge learning curve. But the first, third, and fifth year they're pretty good, especially fifth year. It's a really nice year too. A lot of students can find the time to balance work with study, along with third year especially.
I've never had the opportunity to actually work. I'm quite focused on the course itself, so I feel that it's really important to keep on top of things, and time management is a crucial factor. You're constantly being assessed in the clinic, and you're always kept on your toes, and it's important that you understand the lectures. So personally, I'd rather over the weekends just catch up on work and just keep on top of things, because that's quite important with the course. But if the rest stated, if you can manage that and working at the same time, then good on you.
What I can also add is that many students in our course, many of them dental assist with other dentists, so that it aids in their learning as well. They can ask the dentist questions and if they have any issues. So it'd be worthwhile if one was to if one was to start working, take a job as a dental assistant.
Yeah, what's the length of time that you'll be in the country for dentistry and oral health?
So these are our placement rotations. At the moment, depending on, after I think over what we talked about yesterday when the students were telling me their experience, those placements have generally been 4 weeks.
What's the living arrangements for the
So what happens is, at the moment, we have four country clinics. University owns clinic in Whyalla. We're building one in Renmark, in Berry, and then we use the government clinics in Port Lincoln and Mount Gambier. And in each of those places, one of the universities owns houses. So they'd be sharing accommodation with students from other health, usually health. So I know in Whyalla, where I've worked most, it's UniSA facilities, and there's sort of pharmacy students, nursing students and whatnot. And the university pays for that accommodation at the moment. and you catch the bus up, work for 4 weeks, catch the bus back. That's about right, isn't it? So, yeah. Accommodation is pretty good, except for Mount Gambier. We had a little insect invasion in the house in Mount Gambier, so we've got to get the insects out before the next lot of students want to move in. Apart from that, it's pretty good, isn't it? So what's your experience with it?
I've never had the experience of going out to the rural areas yet, but that's to come very soon.
Anyone been to the country? Yeah. Sorry? In final year. Final year, BOH 3 and BDS 5.
So I was the fortunate one to be the first up to be at the Mount Gambier clinic for the BOH program. So I was phone ready, Facebook, putting all the photos up of the accommodation, everything, and what to expect. But it's a great placement. The tutors there are brilliant. It's great facilities, sort of a brand new clinic in Mount Gambier. They've expanded. And you go
What
down...
about the insect-infested house?
I think that must have come after.
So
I don't know. I hope that wasn't me.
We found the cause.
Yeah, it's a great facility. You go down, so there was myself and another student from third year oral health. There were 2 fifth-year BDS students as well, and you work together as a really good team. So, so the 2 BDS students will be down on the right-hand side, 2 BOH students will be down on the left-hand side, sort of having patients coming through. And it's good you get to sort of work together, understand each other's scope of practice. You can refer, ask questions, learn together, and it's a really good environment. Great placement, bus fares are paid for. There is a small amount of allowance that's paid as well, and it's really enjoyable. You get for ourselves, we had weekends off. It was great. You could go do some sightseeing. Everyone's there is really lovely. The community loves having students down, loves seeing fresh faces. So it's a really great learning experience for us.
Questions come from the audience. Can you just repeat the questions?
Okay, we got other questions? Yeah.
The Bachelor of Oral Health and Dental Surgery pathways so distinct that there's no opportunity to cross over without going back to start.
Yeah, so the question is, are the pathways so different that can you transfer between the 2 programs or not? Pretty much not. I think we've not had anyone that's got credit for anything in the BDS from the BOH, so they're quite different, I think.
So if someone was looking to apply to transfer, basically they restart the whole process again, but instead of using, say, their Year 12 score, they would use their grades from that first year of study, but they don't get any credit for what they've done. They have to start from the beginning again. Yeah.
Other questions? Just grab the microphone if you can.
Just wanted to know, why did you choose to do dental surgery or oral health?
Oral health. Why did you choose to do?
Yeah, I chose dentistry. Main reason is because I wanted to do something health related, and I also wanted to give back. And with dentistry, as you progress through the years, that passion, it matures and develops further. And then when you see that patient interaction, when you can address their chief concern, like I remember when there was one patient that I had, they had 2 awful front teeth, and she couldn't smile, she couldn't talk to the people at the supermarket, and this was in 4th year, and I was able to restore those teeth by placing crowns on them. It changed the life. She was a whole different person. She came in with a new hairdo, and it's just it's just those things that really make you enjoy dentistry. And also, there are these clinics called oral diagnosis. So the patient comes in with pain, and you have to address that concern. They come to your chair, they're quite pissed and angry, and they can't talk properly. But once you numb them up, they're much better. And then especially if you can get rid of that toothache, the next day and you call them up to see how things are going, they're really appreciative of it. And especially when patients come in, they're quite anxious, and you can use your communication skills that you learn throughout the course, and you can calm them, make the perception of dentistry a positive one, and they say to you, you know, like, I haven't been to the dentist in 10 years, but now, like, I want to start going to the dentist now. Like, you changed my life, you changed my perspective. It's all those kind of interactions that really, really want to make you to dentistry for as long as you can work. And also, with dentistry, you got to realize that you have your bad and your good days, it's ups and downs. And it's through those downs, those challenges that make you become better and it pushes you to become like the best dentist that you can become. So it's all those things, and even like the aspects of medicine. There are many medical implications that affect dental treatment, and it's really wonderful when you have that knowledge as well, and you can combine and integrate all the knowledge that you've learned and being able to manage the patient in front of you. And it's definitely a very good, rewarding experience that I recommend everybody doing, if they can.
But how did you know that when you're in year 12?
How did I know it? To be honest, I didn't really know. I got into in my mind, I just wanted to do something that was health related, and that's the honest truth. I got in, not knowing whether or not I would like it or not, and if I didn't like it, then I would change to another degree. Someone once told me, you got to find what you love doing and then do what you love doing. And yeah, first week got into dentistry, I really enjoyed it. I never looked back. And as the years went on, it's something that I want to do. So it's someone's life's calling, whether it's for them or not. And if it's not for them, they should consider something that they have a genuine interest for. Mm-hmm.
What about oral health?
So for me, I worked as a dental assistant previously. I worked with therapists and dentists. I loved how the therapists treated the children, their demeanour towards them, and how they could impact that child and the family. And I think that's how I really got into wanting to do oral health. Dentistry was also another place I wanted to look at. However, I really wanted to work with children, so that's why I took the oral health road.
So there's two ways. You can either know all about it and decide, or you can be like Austin and just have a go.
Yeah, I was very similar to Austin. I had no idea what I wanted to do. I started a double degree of law and science. Bit of a change to oral health. But yeah, I started that. Wasn't for me. Took a bit of a break. Went and travelled. Went to Nepal. Did some volunteering there. And then I came back and I thought, okay, what do I want to do? And I really wanted to do something in health. I loved working with children. Found oral health, and it's been great. I mean, the effect that you can have on patients, I mean, we see a lot of children, so you're setting them up for a positive dental experience for the rest of their lives. So just having that engagement with kids, you're having to incorporate all that behavioural management that you're trained with in your undergraduate, whether it's, something as a simple fluoride, their first appointment, you might be, giving them a ride in a chair, counting their teeth, and you'll see them again, and then you're building upon that rapport, and you're sort of getting that confidence as a practitioner. Something like that, whether it's, filling their tooth or, making the sore tooth not sore anymore, pulpotomy in a stainless steel crown. They've got their little robot tooth, the crown, the princess crown on their tooth. They love it. And, you can always win them over at the end with a sticker and a toothbrush. They love it. It's great fun. Yeah.
Some other questions? Yep, down there. You got a loud voice, or you?
Yeah, I can. I was just wondering, after graduation, what opportunities are there nationally and internationally for volunteering using the skills you've learned positively?
So the question is, after you graduate, what are the opportunities for volunteering and whatnot, nationally and internationally? It's a good question.
Yep. I'm actually an international student, so after I graduate, I'll probably go home to be with my family and just work. And in terms of volunteering, I think locally in Singapore there are organizations or dental groups that actually organize mission trips to go to like Nepal or Cambodia and other countries to do dentistry, to have that experience. But most of these are independent organizations. I think the school also organizes overseas mission trips as well to different countries. Yeah.
So Will and I are going to Cambodia this year. 30th of June we leave, very exciting. We're going with a group of 12 students and doing some volunteer work both in Phnom Penh and out in the rural communities. There's also opportunity next year and the following years to go as a mentor. So once we graduate we can do that as well and help the groups there. And there is so many opportunities to volunteer overseas through lots of private groups. A friend of mine went to Vietnam with her private dental group. So yeah, so many opportunities out there if you want to.
There's quite a well-developed network. So there's a few local ones, but nationally the Dental Association coordinate, there could be 30 groups. Some are Rotary based, some are through religious groups and all sorts. But there's sort of a network of those connections and people, lots and lots of those programs. So plenty of opportunities and lots of people really engage with that. There's a couple of Adelaide guys that they're getting on now a bit in age, but they were called up for national service during the Vietnam War and have gone back there every year since. And they take a group of people back with them. And there's groups that go into New Guinea. A couple of the oral surgeons go up there and operate for a couple of weeks and teach the local people, upskill them. So there's huge numbers of those things. Very active in the profession. We've had projects into lots and lots and lots of places. So, other questions? There'll be lots of opportunities. Yep, go on.
I guess one of the things is how do you manage the occupational safety hazards that go with being a dentist or an oral health thing? And I'm not just talking about communicable diseases, but also people's bizarre behavioural reactions potentially and that sort of thing, because you're very up close and personal.
Mm. And we're aware as staff that you're up close and personal at quite a young age with not a full set of life experience, but these guys will tell you.
For my personal experiences, never really had an issue with it. Just have to manage it as it comes. But in the early years of the training, in the early years of the 5E program, there were many lectures, seminars, class meetings, tutorials, like patient scenarios, where they actually go through these kind of situations that could possibly happen in the dental chair. And we also focus in the first few years of the program patient-centered communication, and these things are quite they make it very dentally relevant. And we also have the tutor to guide us too. These situations that you mentioned, it rarely happens, and if it does, there's no issues. He gets managed pretty well.
Dentists don't get bitten?
No, not if you're quick enough.
That's sort of leading to the volunteering as well. What would happen in that scenario?
Yeah, we're very aware of that. It's a big issue and we're very careful of all sorts of things about that because it's a high-risk area, and putting people into an environment that's not completely safe would be unacceptable. We don't go to those environments without some of our staff going, or people that into programs that are well established where we know the environment, because you can put yourself and others at great risk. I think it's a big problem. Just Melissa can have a go in a sec, but the well-being of ourselves and our students is a critical thing. We have lots of big picture things, just the usual occupational health and safety stuff. But it goes down to, I don't know whether you guys did the hand strengthening exercises that are in. So we're aware of the occupational risks down to you can finish up with tendinitis in your thumb. So we have programs that students go through right at the start to make them aware of that, to put into place remedial stuff. As the head of school, I monitor every incident that goes on in the schools. You don't know all the details, but if we see any pattern of anything from the water line leaking and someone slipping over, all that sort of stuff. But we have, micro-level programs that address all the things. I've got photos in my phone of students that are in the group I tutor, where we continually monitor their ergonomics. And that would be something that if I was teaching today and I noticed a student that's working like this, then we'll have a little photo in my phone we'll go through after that, because you can't practice for too long like that before you spend the rest of your life like that. And that's not a good outcome. So it's a critical thing. If you don't look after your own health, you'll be no use to anybody in the long run. So.
Yeah, just adding on to what Professor Richards was saying, from the very beginning in first year, we have very good training on infection control and just standard precautions, treating every patient as if they have the potential to spread, a disease, and that protects, yourself and your staff around you as well. And in terms of the behavioural management, if you have a patient who comes in a bit angry or upset, we're also trained to deal with those kinds of situations. In second year, we actually have actors. We have these tutorial sessions and actors to come in for different scenarios like angry patient, impatient patient, and we're being constantly critiqued on how to deal with those situations. So I think the school really prepares you and looks after, you, and they have your best interest at heart.
So more questions?
How many people are accepted into the course each year?
Into oral health? Yeah, so oral health's got 30 new places generally. Sometimes we overfill that a little bit, but we aim to have 30. So we take the best 30. So there'll be a lot more than 50. There'll be 1,200 or something. So we get a massive number of applications. I don't know for BH, but so Nicole will be able to tell you the official answer, but
yes,
it's just very competitive.
It is very, very competitive, and a lot of the clinical degrees are, very competitive to get into. But we always encourage our students to have a backup plan, and that would be ideally another degree in health, although, as Will said, it didn't have to be. But I think one of the other sessions we have today is our new Bachelor of Health and Medical Sciences degree, which, whilst it's not a pathway directly into any of the other clinical programs, it does give students another insight into the health professions. The language is the same, the terminology is the same. So we always encourage students to use all of their 6 preferences in their SATAC application, and one of them might like to be one of the other health degrees.
So if you take the Bachelor of Oral Health, for example, it has interviews as part of the admission process. You'd need to work out which part of the process you did least well at. And if that was the interview, then the interview draws on life experience, but also your knowledge of dentistry. You could go down a pathway that Karen went down, for example, and you could work as dental assistant, and that would give you a deep understanding of dentistry. And when you came to the interview, it would give you plenty of things to talk about. Yeah, so I think for people, my personal advice, and everyone's advice will be different, but if you decide you really want to be an oral health therapist, then your backup plan might be to get a job somewhere in dentistry and learn more about dentistry, so that when you come next time round to the interview process, that you're well placed. If you're not sure if it's oral health or could be something else, and you would consider other things in health, you might be better off to enrol in the Bachelor of Health and Medical Science degree. So that will give you the academic background then and a tertiary record to show that you're capable of studying at that level, and that would be a pathway. It really depends on, it's just me personally, but I think if you're desperate, you're absolutely certain you know what you want to do, then there's a different outcome to if you think, well, I wouldn't mind to do this or that. Some people, I was lucky personally that I've always wanted to be a dentist. Must have been born like that, I think. But can't imagine doing anything else. So for me, if I hadn't got into dental school, I would have done something else in dentistry and kept applying till. If I hadn't have been sure whether I wanted to be a dentist or an architect or a lawyer, I would have had a big problem, because then what do you do until you get in? But
I think the hard thing too is that people often think that they've done something wrong because they didn't get into the profession, the degree at the beginning, and that's not necessarily the case. It just means that because it's that merit ranking process, the people above you did slightly better, but it doesn't necessarily mean that you did anything wrong. And that's sometimes a bit of a hard thing to, when you're year 12 and you're very high achieving and this is what you want to do, it's very difficult to sort of accept that. But as Professor Richard said, if you really, really want to do something, you will get there. It might just not be that direct path. It might be another road to take before you actually achieve that. So hence us recommending one of the other degrees as well. So,
And you have to think...
I think we've got... Sorry.
You have to think, for dentistry, some people just want to do dentistry in Adelaide. Well, you just have to keep applying. Some people really want to do dentistry and they don't care if they do it in Adelaide or Perth or James Cook. Well, there might be an opportunity somewhere else. So they're all sort of personal choices. I think on the UMAT, it's a very important point. A lot of people say to me, oh, my daughter failed the UMAT. You can't fail. There's no pass mark. It's just a ranking. So it simply means that if we were looking to interview 250 students for our dental program, it means you weren't in the top 250. Not that you didn't do well. It's just that you didn't do well enough to get in the top 250. And we're in the privileged position, the embarrassingly privileged position, that we can take just the very top 250 people, of whom the first few thousand are all very, very good. But we just looked at the top 250. So.
I think we've got time for one more question. There will be some more opportunity after the presentation finishes to speak with our presenters and panellists out in the foyer area. So if we have one more question now, and then I've got a couple of more points to go through, and then we'll finish.
Could you elaborate more on this very last topic about if you really, really want to do dentistry, there are other ways. If at first you cannot get in, there are other ways. So can you be more specific? What are the other ways?
Okay, well, it depends where you want to go. So if you... there are 3 programs in Australia that are graduate entry programs. So you could do another degree. You could do an Adelaide Health Science degree. And then you could apply for one of the graduate entry schools, Perth, Sydney or Melbourne. You could work in dentistry and then apply again if you thought that gave you a better chance at the interview. You could enrol in our Bachelor of Health Science degree, and then you could apply to transfer or apply for dentistry after that, or you could apply on your tertiary record during that. So there are many, many, many pathways. And it really depends, first of all, whether you want to be a dentist and you're prepared to study anywhere. Then there's choices. If you really, really want to come to Adelaide, which I think is a very good choice, but then you would need to improve on whichever of those things meant that you didn't get ranked high enough on the UMAT to get an interview, or that your ATAR was it'd have to be 90 but wasn't high enough, or that when you came to interview that you didn't rank in the top 40 or 50. So, and an analysis of that would then give you an idea of which area you need to improve on.
I'd like to add on to that. This is actually my second degree. My first degree was in biomedical science at the University of Western Australia, and then I applied for dentistry after that. Didn't get in, but I knew in my heart, this is what I really wanted to do. So I did my honours and I applied. I didn't get in, so I took 2 years off because I was working, and I said, I'm just going to study for all the entry exams because I know this is what I really want to do. And I got in here. So I think the perseverance and that tenacity that, that will get you through the course, that's what you need to start with. So, yeah.
Okay. Austin, did you come straight from school?
Well, hello? Yeah, I'm from Sydney originally. I went to a school called North Sydney Boys, and then finished high school. I wasn't sure what I wanted to do first, so I took a year off to take some time to think about it. And then just had a few jobs here and there. Did a few volunteering opportunities, and then once I made up my mind that I wanted to focus on health related, and then I thought dentistry seemed like a good idea. It seemed like it was for me. And then I stuck with that. Thought about it, and then applied for it, and then got in the next year. Everyone has different pathways of getting into dentistry. Some would find that some will have it easier than others. Some will find that it takes many attempts to get in. You'll find that in the dentistry program, the cohort is quite diverse. Everyone's from everywhere. A lot of people are actually from Sydney, Melbourne, overseas, And there's a fair few people from Adelaide. And it's just, as Melissa said, just that perseverance and that determination to get in. And even if you do get into dentistry, the next question is, do you actually want it? And that will come, and that's just individual preferences. But yeah, it's hard to know what you want to get yourself into once you get in. And for me personally, and I'm sure with Melissa, we really enjoy it. So it's good.
We need to move on from. Move on from this facility.
It's all right. I've just got a couple more slides to go through, and then we will be able to make our way out the foyer to speak with our panellists out there. So hopefully our presenters and students have inspired you to apply to the University of Adelaide and consider a career in dentistry or oral health. One thing we're very aware of is that when you are coming from high school, like a lot of you, it is very different. University is very, very different to what high school is. So you're expected to be a very independent learner, to be very proactive, and keep track of your work. There's not going to be anyone saying, your assignment's due on Tuesday, your assignment's due on Tuesday, your assignment's due on Tuesday. You will be expected to know that, and you'll be expected to submit that accordingly. So one of the things that we have actually developed is our peer mentoring program. So it's a transition program where it can help you transition into university and understand what's actually expected of you as a new student. So we have senior year students who will actually be your buddy, for want of a better word, who will show you the ropes, explain to you what's expected, tell you where to buy cheap food and coffee and things like that, but also to just to help you to have that friendly face to have your questions answered. And I think Austin is part of our program this year. It really just helps you to settle into university so that you can really concentrate on the most important things, which, as the panel have alluded to, is your study. So I would really encourage you to consider the program. We do have mentors who mentor you in face-to-face weekly meetings where a group will get together. If your timetable doesn't allow for you to have that weekly meeting, you can have a mentor who will mentor you online. So they'll communicate with you mostly via email, but they will get that really necessary information to you in either way. Okay, open day is your next opportunity, so go home, have a real think about it, come back on the 14th of August and talk to our students, talk to our academic staff in a little bit more detail. We will have some talks similar to this on open day, so you'll be able to download the program soon. So I'd really encourage you all, and it'd be great to see you all again. And finally, we do have a Facebook page where you're welcome to like us on Facebook and keep up to date with all of the cool things that we do here on campus. It's a good way just to sort of make that connection early to see, you know, the types of things that happen around day to day, and some of the community work also that, as the students mentioned, that they're involved in. So I would encourage you to do that as well. Okay, ladies and gentlemen, thank you for attending today. If you have further questions for either our academic staff or our students, they will be located just in the foyer area for the next 10 or 15 minutes. If you could exit via this door on this side, and they'll be able to help you out from there. Okay, thank you for coming.